A genuine smile comes from the heart, but a healthy smile needs good dental care. Very good evening, viewers. Welcome to an exclusive health talk, BMC Global Live AL-HILAL Health World. Nothing but lifestyle. Myself, Marina Francis. Oral or dental care is one of the essential part of our overall health and well-being. And definitely this can be achieved only by having a healthy lifestyle. So our topic for today's discussion is gum diseases. Dental problems like gum diseases can impair our ability to eat properly, to speak properly. It may cause pain and many other health difficulties. So let us see how we can prevent or overcome such issues. So let me welcome happily today the doctor joining with us, Dr. Jesna PM. She is a dentist with over 12 years of experience, completed BDS from Yenipoya Dental College, Mangalore, currently working at AL-HILAL Hospital, Manama branch. So let us begin our today's Health World episode on the topic gum diseases. Very good evening, doctor.
Good evening.
Welcome to today's episode of Health World.
Yeah, thank you.
Doctor, so we have taken the topic gum diseases. So let us start with how are gum diseases seen and what are the causes that can lead to gum diseases?
Gum disease is actually the inflammation of gingiva, and the causes are mainly due to bacteria or plaque. The other causes like smoking, nutritional deficiencies, hormonal imbalance, malaligned tooth, and some medication can also cause gingivitis or gum diseases.
Okay, doctor. So what are the symptoms for gingivitis?
Bright red or swollen gums, then bad breath or halitosis, then bleeding while brushing the tooth or flossing, then receding gums. That is the main symptoms we can see in gingivitis.
Okay. So doctor, if gum diseases are left untreated, then what could happen? Are there any side effects?
See, this is a gum infection, is a severe infection. If left untreated, it can lead to a cause called periodontitis, which will damage the supporting tissue of the tooth and which causes a loosening of the tooth, and eventually the tooth will get loose. Loosening will be there.
So doctor, when you told about the causes of gum diseases, you mentioned about smoking. So how can smoking affect the gums?
Smoking is a well-established risk factor for gingivitis. In the smoking, the cigarette, there is nicotine, carbon monoxide and tar. Nicotine will cause addiction to the body, and the carbon monoxide and tar will affect the blood circulation. So if the blood circulation is reduced, there is lack of oxygen will result. That will affect the healing of the infected gums. And smoking is a major risk factor for oral cancers. Smoking can also cause dryness, then fungal infections, bad breath, etc.
Doctor, while talking about oral health problems, bad breath is something that most people find difficult. So what could be some causes of bad breath?
Bad breath, it is mainly due to poor oral hygiene. Then dental caries is a other problem, then food impaction, tobacco, any other cigarette products are there. No? Then our medical problems like gastritis, and even some medication can also cause this bad breath.
So doctor, you mentioned about the causes of bad breath. So how can we prevent bad breath? What must we take care?
Okay, bad breath or halitosis, it is also known as halitosis. It can be prevented by using dental flosses or mouth rinses. Then brush the tooth twice daily. Then if you have any dentures or any retainers are there in the mouth, you have to clean it. Then have lots of water. Then adjust your diet. Then avoid spicy foods. Then have a regular dental checkup with the dentist and do scaling every 6 months, scaling or cleaning every 6 months.
Doctor, while telling about the causes of gum diseases, you mentioned about hormonal imbalances. So a doubt that may arise is what precautions should a person planning to get pregnant take regarding gum health or oral health?
It is recommended to do complete dental checkup before anyone is planning to get pregnant. or and we should take the patient's gynecologist consent for any procedures or any treatments, any medications. We should take the patient's gynecologist consent. Then in severe, if any emergencies, treatment should be done, that is like severe infections, trauma, we can do, but it is better to do any treatments in second trimester, that is from 4 to 6 months. Then avoid radiographs, which has to be taken in most of the dental procedures. It is better to avoid radiographs. And this dental procedures are, some procedures are long, it will take time. So that will cause stress for the fetus as well as the mother. So it is better to avoid any dental procedures during pregnancy and do a complete dental checkup before anyone planning to get pregnant.
So thank you, doctor. Those points are very useful for most viewers there. We have seen many aspects regarding oral health, regarding gum diseases and bad breath, and many aspects which are very common among most of us. Anyway, we have more questions to go. We will be back after a very short break. So stay tuned. Welcome back. You're watching BMC Global Live AL-HILAL Health World, an exclusive health talk. So we are discussing today's topic, that is gum diseases and in general oral health. So let us move on to a few more questions regarding oral health. So doctor, one common doubt regarding dental problems is scaling or cleaning of tooth. We always have the doubt whether it is harmful for our teeth, or when we are discussing about gum diseases, will it affect our gums? So how would you address that?
See, this is a misconception that most of the patients have. When they come to clinic also, they have the same question.
Yes.
But I said sincerely, it won't affect the tooth or the gums.
Okay.
It is recommended to do a complete scaling every 6 months.
Okay.
Once in a 6 months, you should do scaling or polishing.
Okay.
And it won't affect the gums or teeth.
Okay. So doctor, could children also do scaling or cleaning of the teeth?
Obviously, children should also do scaling or cleaning, because most of the children will have poor oral hygiene. Their brushing technique will be different. They doesn't know, they don't even care about that. Children,
Yes,
as
yes.
we all know, right? So it is better to do, for children also it is better to do scaling once in a 6 months and do a regular checkup for the kids also.
Okay, so I think if we are talking about different age categories, maybe children have more chances of getting gum diseases, and they too can undertake scaling.
Yeah.
Doctor, I think one important question to ask is whether diet can be related to dental problems or gum diseases, or if so, how can we modify our diet to avoid or prevent such diseases?
Sure, that has a major important role in dental health. That is, it can cause that sugar content food, more carbohydrate foods can cause dental caries as well as gum diseases. It is better to avoid aerated drinks and soft drinks. That causes abrasion of the teeth also. It can cause abrasion of the teeth. Okay, then avoid spicy foods and this food that causes staining of the teeth. Some colored food that causes staining of the teeth. It is better to avoid that type of foods to have a healthy oral hygiene.
So doctor, after talking about diet, when you mentioned about the causes of gum diseases, you said about nutritional deficiencies. So how can nutritional deficiency affect gum health, or if so, what can be done about it?
Vitamin C plays a major role in gum diseases.
Okay.
A deficiency of vitamin C can cause a disease called scurvy.
Okay.
That causes a bleeding of the gums.
Okay.
So it is better to have a food rich in vitamin C. That it is good for gum health.
Okay.
It causes strengthening of the health when gums also.
Okay. Doctor, you mentioned about bleeding of gums. So we may face different kinds of gum difficulties. So a common doubt is, when should we visit a doctor? When should we seek treatment?
See, bleeding of gums is the main reason.
Yes.
Other than that, you have red or swollen gums.
Okay.
Then pain while having food.
Okay.
Then bleeding, as I said earlier, bleeding.
Yes.
Then bad breath.
Yes.
If
Yes.
bad breath is there. Then sensitivity.
Okay.
Other cause will sensitive. People will have sensitivity while having cold drinks or hot and cold water. Some people have sensitivity at times.
Doctor, since you mentioned about sensitivity of teeth, so that is a common issue I think among many people. How can we avoid sensitive tooth?
Sensitivity, actually it is caused by our brushing techniques, mainly brushing techniques, and the
Okay.
type of the brush we use,
Okay.
and some food. I mean, as I said earlier, aerated drinks can also causes abrasion of the teeth.
Okay.
That causes sensitivity. We shouldn't have a medium or hard brush.
Okay.
We should have a soft brush with a circular and soft motion. We should brush the teeth with a circular and a soft motion.
Okay.
Then avoid drinks, aerated drinks.
Yes.
Then if you have so much sensitive, you can use a sensitive toothpaste.
Okay.
And if it is severe, it is better to consult a dentist and take a treatment for that.
Doctor, you mentioned many aspects about gum diseases in this episode. Since our topic is gum diseases, I think the most important question is how can we treat gum diseases? What is the treatment procedure?
See, for gum diseases, there are two phases. That is surgical as well as non-surgical, is there.
Okay.
Non-surgical, we will do scaling, then root planing, and if severe infection is there, we will give antibiotics.
Okay.
But surgical phase is different. It is according to the gingival enlargement is there, we will do gingivectomy, gingivoplasty, that is shaping of the gingiva. And I said if gingivitis is left untreated, it can cause a disease called periodontitis. In that case, according to the severity, we will do bone graft with flap surgery.
Okay. Doctor, one common doubt that few people have is fallen tooth or loosened tooth. Can we fix it? How can we fix it?
See, the loosened teeth, that is due, if it is due to gingivitis or periodontitis, we can't save it.
Okay.
If it is loosened because of periodontitis.
Okay.
But if it is loosened because of a trauma or an accident,
Okay.
and the tooth is intact and it is not broken,
Okay.
within 1 hour, the patient has to report to the dentist. In that case, we can fix the tooth, and the patient should bring the tooth either in saliva or patient's own blood or in milk.
Okay.
They should transport that tooth in that solution.
Okay.
Then we can save the tooth.
Doctor, so we discussed about various aspects regarding gum diseases, regarding general oral hygiene. So what could be one, in short, a takeaway message for our viewers today?
See, gum disease is a common disease, but most of the patients are unaware of the disease. 80% of the cases come to the clinic with the advanced stage or the late stage.
Okay.
In that case, saving the tooth is very difficult.
Okay.
So I recommend every one of you to do a regular dental checkup every 6 months. Change the brush 2 to 3 months, in every 2 to 3 months, and use smooth brushes. I mean soft brushes.
Okay.
Hard and medium, avoid hard and medium toothbrushes. Use soft brushes.
Okay.
Then avoid smoking and tobacco, and do regular dental checkups and scaling and polishing every 6 months.
Okay.
Yes.
Thank you very much, Doctor. You answered many of our queries. I definitely understand that this episode would have been very informative for all viewers out there. So we'll be back next week, same day, same time, in the next episode of Health World. Until then, this is Marina Francis signing off. Keep smiling, keep spreading smiles. Good night.